LGBTQ seniors, just in case you didn't know. LGBT older adults are twice as likely to remain single as they age, twice as likely to live alone, and are 3 to 4 times less likely to have children to care for them. What is Congress able to do to address the shortage of quality, affordable, and long-term care for people aging alone? Are there any champions for this issue in Congress?
Beside yourself.
And what are they proposing? You know, this is, and it's not just, well, it's LGBTs, including transgender people. I know T means transgender, but I want to make sure people understand that.
Well, right now, so to my knowledge, nothing is being proposed or pursued. We should. There's no chance of getting something like that done in this political environment in the Congress. But you know, when you discriminate against people, it has a lasting impact. And that's true whether you're discriminating against people because of their ethnicity, or their gender, or their orientation. I mean, marriage equality has only been the law for a few years. So it's not a complete surprise that, you know, LGBTQ seniors might be alone more than otherwise without marriage equality, 40 years ago. So I think we need to make sure that there's ways for people not to be alone when they're old, whether or not they have a spouse or a child. And there are models that make that work in this community. Some of them are just happenstance. We were talking earlier about mobile homes and how you have a community room, you have a community, you know, that develops. Because of low density, that's not necessarily going to be present in every community, but you can plan so that that happens. The major role that the federal government would play would be financing to build and structure such facilities, and also wraparound funding so that supportive services could be made available. We don't have anything in place for long-term care at the federal level, except for Medicaid, which they want to cut. And Medicaid is not a very good, better than no answer, but it's not a good answer. 2/3 of the nursing home beds in the United States are paid for by Medicaid, but you can't use Medicaid for alternatives to a nursing home, which is cheaper and better for people. So we need to actually restructure the whole thing. To do that, we're going to have somebody who's more interested in investing in people than a wall, and to use our resources thoughtfully, working with local government. I was in local government before I was in Congress. It's at the local level, cities and counties, where the actual construction can be fomented, but we should be partners in terms of the financing of that, not only the building, but the supportive services.